Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Secura Extra Protective Cream. But first, if you could hit that subscribe button, it would be greatly appreciated as it is a free way to help my channel grow. So let's get started. So the Secura Extra Protective Cream is a 30% zinc oxide cream in petroleum with Caraya to absorb moisture. It may be used on denuded skin also. So indications for use, so we're going to use this for prevention and treatment of moderate to severe incontinence-associated dermatitis, and for the prevention of incontinence-associated dermatitis in cases where severe diarrhea due to C. diff or other gastrointestinal conditions, so we can prevent it using this cream. Precautions, we want to avoid the eyes. Contraindications, we don't want to be using in patients with a known sensitivity to zinc or Caraya. We want to make sure that the patient always has a clean brief while using this, and we don't want to be using petroleum-based products during hyperbaric oxygen therapy, so we wouldn't use this product during that therapy. So to apply this cream, you want to start by having a cleansed area, and you're going to apply the cream onto the skin, and you're only going to apply in one direction. We're not going to rub it. We're just going to gently spread a thick 5mm layer of cream over the affected area, okay? And you're just going to keep repeating this until the whole area is covered. Now, after an episode of incontinence, wipe urine and stool from the top layer and use a Remedy foam cleanser. Use that cleanser. It will just take off like the top layers of this cream, and then you're going to reapply more of the cream as instructed above. So frequency of application. So you're just going to continue the treatment until the area has improved and or the diarrhea has subsided. Okay, so you're really using it as much as needed. Now to remove this cream, you don't actually have to remove the cream completely when you're reapplying. So what you do is use the Remedy foam cleanser. You apply it, leave it on for about 2 to 3 minutes, and use a warm damp cloth to gently wipe the top layers off. Now if you want it completely removed, just keep repeating those steps until it is completely removed, but it is not necessary when reapplying. You just want a clean base and then add more. After a few times it might get quite gunky, so you do want to remove it all. Just use your better judgment when doing so. So the expected outcome is that you use it for about 4 to 6 days, and that's usually adequate for healing severe excoriated skin. If it hasn't, then you want to consult with a wound care consultant for further treatment strategies. Format and sizes, it does come in a tube and it's 114 grams. So that's all I have for this video. I hope you did find it helpful for your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated. And I will catch you guys in my next video. See ya.